It's Breaking the News time. I'm Janice Shortle. So we got 1 week. That's the amount of time our state lawmakers, who you put in the job, have to finish the 2-year budget. It's due on May 19th. But one key hitch in these negotiations has to do with health care and whether undocumented immigrants in our state should have access to our state's programs. Danny takes a look at the issue tonight.
With only a week left in the legislative session, Bishop Kevin Kenney came to the state capitol Monday with a message for lawmakers.
I'm here because of my love for the immigrant brothers and sisters.
Bishop Kenney, representing the Archdiocese alongside the Minnesota Catholic Conference, urged the legislature not to roll back health care access for undocumented immigrants.
This room would have been full of our immigrant brothers and sisters, but they're afraid to leave their homes. They're afraid to go out into the streets. They're afraid to have themselves on TV.
Under a new law this year, undocumented immigrants are eligible for a state program known as Minnesota Care, which provides health care to lower income people who don't qualify for Medicaid. But with a tie in the House now, Republicans are demanding changes to that law, arguing it's too expensive.
We've heard from Minnesotans across the state, and looking at the cost and the increase of cost on that, that is still something that is in discussion.
According to the Department of Human Services, roughly 20,000 undocumented people have enrolled in Minnesota Care so far, for a total cost of $3.9 million in paid claims. Democrats in the House and Senate say they're not interested in revoking access.
We understand the importance of covering people. Our caucus would support coverage of everybody.
I recognize the member from Anoka.
After weeks of debate, the health budget bill that came to the House floor on Monday did not include any provisions about undocumented health care. Still, Republicans plan to keep pushing the issue during final budget negotiations between the House, Senate, and Governor.
I think the Archdiocese is leading on this, that health care is a human right.
Governor Walz says he's open to some compromise with the GOP on the issue, just not when it comes to kids.
You've got to cover children. Those children are not, they didn't make the choice, and whether you disagree with the choice, you think something could be different, these children need to get health care.
Lawmakers have until next Monday, May 19th, to sort through this disagreement and a host of other issues where they don't quite see eye to eye. If lawmakers don't get their budget done on time, Governor Walz would need to call a special session. At the Capitol, I'm Danny Spiewak, KARE 11 News.